Welcome to A View from the Corner Office, the CEO series brought to you by Arizona Business Magazine, Grand Canyon University, and the Phoenix CEO CFO Group. In this edition of the CEO series, we talk to Linda Hunt, the area president of Catholic Healthcare West and the president and CEO of St. Joseph's Hospital and Medical Center. She talks about how St. Joseph's is preparing for healthcare reform and also about the legacy it has in Arizona.
When the sisters got here in the 1890s, they found a very small community here of people who were working here, but many people who had come here because they were ill. And they came here to teach, and all of a sudden they looked around and they said, my gosh, it's not about teaching. We've got to provide health care for these people. They're dying in the streets. So I feel like we are the beginning of health care in this community and have continued for almost 116 years. When you look at a number of firsts that were done at St. Joseph's, many times we brought health care and progressive health care to this community. When you look at the first residency, the first pharmacy in-house, the first NICU, the first MRI, the first CAT scan, and you can go down the list on all the numbers of firsts that St. Joe's brought to this community. It truly is a jewel to be, treasured in this community.
St. Joseph's may be a jewel and a leader in the healthcare community, but Hunt and the rest of the staff at the hospital never forget that they are indeed part of a community.
Well, I think we all compete. We are, businesses, but I think it's a camaraderie because we're all about taking care of people in this community. And I think when you look back, there are a lot of great friendships that you have with the other CEOs. And we do share. We share resources. When we get in trouble, as a level 1 trauma center, when we're overwhelmed, everybody pitches in. We fan out patients. We do a number of things together. If we need equipment, we lend it to each other. So in a way, we compete, but yet we are all here to serve this community, and I think that's very important.
That sense of camaraderie in the healthcare community was enhanced during and after the mass shooting in Tucson. Hunt says it also sent a clear message to the legislature.
It truly is the life-saving component of healthcare. If we would not have had the hospital in Tucson, if we would not have had the trauma surgeons, the neurosurgeons right there ready, a number of those people wouldn't have survived. I think Gabby Gifford could really say one day, I owe my life to these people and for the quick response that they had. We have very limited funding. As you know, it really is not about money coming in from the federal government or the state government for level 1. It's really thanks to a number of our patients who have insurance and the grateful donors or a variety of people who give to us to make sure we can continue to have the resources available to provide that kind of care.
Like other hospitals in Arizona, St. Joseph's is bracing itself for possible cuts to the state's Medicaid system.
It's a tremendous strain if we have the budget cuts that are proposed. About 44% of our patients are access patients, and this will anywhere between, I would say, $25 to $31 million for just our organization alone that we'll see decrease from what we have to actually deliver care.
Recently, St. Joseph's was in the news when the Roman Catholic Diocese of Phoenix stripped the hospital of its Catholic status. This after the hospital terminated the pregnancy of a woman whose life was endangered.
We acknowledge that the bishop is the moral authority. We acknowledge that, he had the authority to no longer designate us as a Catholic hospital. We were all very sad about that. But really, when it comes down to it, we're about saving the lives of the patients that we can save, and that was what we did. And unfortunately, we came to this end, but we will always take care of people who are here and do what we can do to make sure they are safe and they receive the care that they deserve. I think we are the same organization. We follow our Catholic tradition. We've done it for 115 years, and we will not change. The Sisters of Mercy are still here. They're guiding us. We live by their vision and their values and their mission, and that will continue. So in my mind, as a patient, just like in the past, in the future, we will provide you excellent spiritual, physical, and mental care so that your mind, body, spirit are all taken care of.